The First Lady of Kwara State, Ambassador Olufolake Abdulrazaq, has called for intensified research efforts for more effective treatment of the Sickle Cell Aneamia Disease. Ambassador Abdulrazaq made this call at a day program organized to commemorate the 2022 Sickle Cell Awareness held at the State Banquet Hall, GRA, Ilorin. Our reporter Timileyin Okunola has more.
Sickle cell anemia is a deadly disease. Each year, it kills thousands of lives and millions of people are being wasted. In a bid to curb this menace, the Kwara State First Lady has organized a day program tagged Shine the Light to commemorate 2022 Sickle Cell Awareness. While addressing participants at the one-day Sickle Cell Awareness program, Ambassador Olufolake Abdulrazaq disclosed that Sickle Cell Awareness Month is a time set aside to acknowledge challenges faced by people living with sickle cell. Madam Olufolake further assured Kwarans of the state government's continuous partnerships with non-governmental organizations and multinationals in supporting people living with sickle cell.
Sickle Cell Disease Awareness Month is a time to acknowledge the challenges faced by people living with sickle cell disease and to reaffirm our collective commitment to increasing advocacies that would ensure that they are able to access quality and affordable treatment options, support and care. With an estimated 150,000 babies born annually with sickle cell anemia, regarded as the most common form of sickle cell disease, Nigeria accounts for almost half of the share of more than 300,000 babies with severe hemoglobin disorders born globally each year. In many cases, sickle cell disease cannot be cured, so lifelong treatment and monitoring are needed. There are a few different treatments which help to prevent sickling episodes or prevent related problems such as infection, but many treatments involve providing comfort and pain management.
She also commended the efforts of government at all levels and non-governmental organizations championing the advocacy of the need for childhood and premarital genotype tests, emphasizing our office's readiness to increase sensitization that would enable people to have access to quality and affordable healthcare.
This year has seen us amplify our awareness on the disease and increase significantly our support for sickle cell warriors through the procurement of additional 100 units of health insurance cover during the 2022 Sickle Cell Day in June, in addition to the ones procured in 2021 to support the care of people living with sickle cell disease. In commemoration of 2022 World Sickle Cell Awareness Month, however, I intend to continue advocacies with Ajika People Support Center and our partners to stop the stigma attached to sickle cell while making proper efforts to stem the disease. Advocate for world-class healthcare and intensify research for better treatment that will give those affected by this disease a better quality of life.
The First Lady revealed further that Nigeria accounts for almost 300,000 babies with severe hemoglobin disorders born globally each year. Also speaking at the event, Kwara State Commissioner for Health, Sickle Razaq, implored parents to give proper attention and good nutrition to their wards. The chairman of House Committee on Health at the Kwara State House of Assembly, Honorable Razaq Olatunde Owolabi, who was also present at the event, lauded the efforts of the state government in catering to the needs of people with the sickle cell disease. He further urged society to desist from stigmatizing such people.
Disease is one of the major problems facing our society, especially in the African continent. The caring news, however, is that it is preventable or reduced to the barest minimum, if not totally eradicated.
In her address, a sickle cell warrior, Titilayo Bamidele, who narrated her experience, said Nigeria accounts for a higher number of sickle cell disease in the world, hence the need for intensified efforts to curb the menace.
From the date of diagnosis till today, I have had 11 major surgeries, 4 follow-up surgeries on my eyes, at least 119 hospital visits, a diagnosis for thyroid cancer, a new diagnosis for arthritis just 2 months ago. I have had multiple blood transfusions. I currently live with an implant in my hip and in my knee, and I have wished for death on so many occasions, and I struggled with self-esteem and confidence.
She thereafter advised carriers to keep their hopes and dreams alive and appealed to the public to desist from stigmatizing. As usual, the Kwara State First Lady has once again affected the lives of Kwarans positively with the Shine the Light awareness program. With this program, sickle cell awareness is projected to be more pronounced in the state. Timileyin Okunlola reporting for ANF TV.